Good afternoon and welcome to Leadership in Crisis, Staying Calm and Setting a Course in the Storm, a Health System CIO Media Inc. production sponsored by Lexisnexis Risk Solutions. Just a little housekeeping before we get started. My name's Anthony Guerra. I'm the Editor-in-Chief of Health System CIO, and I will be your moderator today. We're looking forward to some audience participation today. We've got our questions and comments box that you can leverage to get your questions and comments to us, and we're going to do a poll later in the program to get your feedback. This is a nice way to see the Zoom screen today. In the top center, get it into side-by-side mode. Then you can adjust the divider to get those video boxes as big as you like. And you want to say speaker view in the top right-hand corner. Just so you see how we're going to spend our time today, we've got Lacy Williams-Carlson, CIO at Secours Mercy Health, Mike Restuccia, SVP and CIO at Penn Medicine. We will have Joel Venko, SVP and CIO with Baystate Health. He'll be here shortly. And we've got Rick Grape, Director of Market Planning and Innovation with Lexisnexis Risk Solutions. So I think we're going to jump right into our discussion. Lacy, let's start with you. You want to tell me a little bit about your organization and your role?
Sure. Good afternoon, everybody, and I hope all are well. I work for a Catholic organization. We're an integrated delivery network. I never know how to describe size right now because pre-pandemic revenues don't really relate to post-pandemic revenues right now, but we are a $10 billion net revenue health system. This year we acquired the largest private health system in Ireland. So we span over 1,000 sites of care in 2 countries and 7 states. We have 60,000 employees. We see about 10 million patients a year. And we're very proud that we provide about $2 million a day in community benefit across our health system. And my role within Secours Mercy is I'm the CIO for the health system.
Very good. Thank you, Lacy. All right, Mike.
Good morning, everyone. Anthony, thank you for the opportunity to join the panel today. I'm Mike Restuccia, Senior Vice President, CIO of Penn Medicine. And Penn Medicine is the combination of the Perelman School of Medicine as well as the University of Pennsylvania Health System, which consists of 6 hospitals in the southeastern Pennsylvania and now into New Jersey region. The visual on the geography is pretty much from the Susquehanna River to the Atlantic Ocean is our catchment area that we provide service through. About $8 billion in annual revenues and about 4 million in annual ambulatory visits at this point in time. So academic, complex research, a great place to be in these times.
Excellent. Thank you, Mike. Rick?
My name is Rick Grape. I'm a Director of Market Planning and Innovation at Lexisnexis Risk Solutions. Lexisnexis is a data and analytics company, so we bring to bear a number of different data assets that help support clients in the payer, provider, life science, and pharmacy verticals. We work with really 3 main tiers of data, so consumer level information, including socioeconomic data, provider data assets. We have the nation's leading repository of providers throughout the United States. And then our claims analytics suite, which I'm actually over in a market planning capacity, which leverages billions of de-identified medical claims to help provide different clinical, procedure, and diagnosis-based insights. In terms of my role at the organization, market planning is kind of a unique spot in being both kind of an overall market vision and strategy role. So I look at kind of where market trends are heading in a 2, 3, 5-year capacity and help align our sales, our product build, and organizational strategies to kind of align with where we think things are going so that we're prepared to meet those needs and the needs of the community as we get to them in time.
All right, very good. Thank you, Rick. Mike, I'm going to start with you on the next question. Talk about the impact COVID-19 has had on your organization and some of the things IT did to deal with it. So I think we're going to sort of preface or frame our discussion of leadership in crisis, and that's what we're talking about. There's the crisis.
Sure. Thanks, Anthony. I think there were several aspects of COVID-19 that really forced Penn Medicine, as well as probably every healthcare organization throughout the country, to change. And you had to change rapidly. My communications to my team each week is, every week is like a new chapter in a long book. And the technologies and the leadership that went along with each chapter are the things I think we had to exemplify in order to make our way through this journey. If you think back to the March timeframe, at least on the East Coast, when things started to really proliferate, we saw the virus coming. We began to prepare. We immediately sent our staff home, not only our IS staff, but the entire corporate services staff and anyone else who could work remote. So almost overnight, we went from perhaps a few hundred individuals working remotely to, in our case, over 20,000 employees working remotely. And that all took place within just a matter of days. So that was a first chapter. But then we began to look more closely at perhaps patient safety and most importantly, employee safety. And what were we doing from a supply chain perspective, and what we were doing from a technology perspective to protect them. And I have a long list here that I could go through, but I'll certainly give Lacy a chance. I did want to call out, and being an East Coast leader, we did have the advantage of learning a little bit from the West Coast. And I'll particularly call out the document that University of Washington put out that was sort of the playbook, the guidebook of what they went through in the months of January and February that helped us here to better prepare for that wave and surge and things we'd have to do at our electronic health record and new technologies and video teleconferences, those types of things. So from a leadership perspective, I think working as a team was important. I think learning from others was important. And I think communicating constantly or consistently was also important. And I'll hold there. Get with you.
Thank you. Lacy?
I think, Mike, I got to talk to you about how you got 20,000 people remote. We have about 7,000 of 60,000. So all of our corporate services are remote, but of course the folks in the field to a large degree are not. It's really interesting to think about COVID and its impact on our organization because of our geographic dispersion. So how we were responding in Ireland had a lot to do with Ireland's overall national response. How we responded in Virginia, Ohio, South Carolina, Florida, respectively, had a lot to do with incidence and prevalence in each of those markets. Mike, you mentioned being able to learn from the West Coast. We actually learned from some partner facilities that we have, Good Samaritan in Suffolk, New York, in Rockland County. Huge impact. And one of the frustrations that we had at times was, depending on the geography, and I'll just say it, the politics of some of those geographies, you saw some markets really taking it seriously, and this is coming and we need to prepare and double down on PPE preservation, and other markets who kind of, the tone in their community was, this is overblown hype, it's not coming to us. So we had conference calls with our colleagues in New York to understand how very serious it was, it would impact our organization. Had about 4,000 patients across, excluding our New York partner facilities. We've had about 4,000 positive patients. We're currently at our lowest COVID positive census to date since it started occurring, at only around 200 patients. In terms of IT support, the same thing as Mike talked about, like literally from a Friday to a Monday, the decision that folks were going to transition to home. Not only were folks who were used to working from home stepping in, but folks who frankly never worked from home. We were packing up desktop computers and issuing guidance on how to connect to home routers and so forth for folks who never imagined themselves in that kind of a role. Constant changes to our Epic instances to accommodate potential or real changes in bed type of access. Again, with the geographic dispersion, it felt like every day was a hodgepodge of lab solutions. You know, this governor mandated all these tests are going here. Okay, never mind. Now they're going here. And my poor interface team and lab folks were constantly ripping out what they had just built the week before because of, you know, the testing changes. But as Mike was very considerate in not taking up the podium, I'll give it, go on and on if Mike could.
Very good. All right, Rick. So as a service provider or vendor, whatever you want to call it, you have your own needs as an organization. You have to get everybody home. You've also got to continue supporting your customers. So if you want to address some of that, and innovation, as I say, innovation is in your title, and innovation was probably called for quite a bit to manage a crisis. A crisis requires people to be innovative, so that can be an important part. So just address wherever you want to jump in there.
Sure. Like you know, some of the other speakers have mentioned, as the initial impact of the pandemic started to really make effect on our internal company's population, we saw offices closed, transition of all employees to a remote status. You know, that had, as I think most organizations experienced, some technical difficulties at times with new VPNs having to be created, new collaborative technologies being used for the first time. We had a good number of folks that worked from home in various capacities. I'm a home-based employee myself, so from a day-to-day, there wasn't change as much in how I went about my day, but the interactions with folks were very different as many were moving from an office environment to a home-based environment for the first time. We saw from like an IT internal standpoint that we altered permission levels to optimize bandwidth. We saw from our leadership team much more frequent check-ins, all hands calls, different employee wellness initiatives that were launched. And I think that's actually something that trickles to kind of all aspects of organizations, is the need for greater, more open and transparent communication, not only with your staff, but with your customer base, obviously. So with the folks we approached and talked to and our clients within the industry, we generally take a data for good approach. So we work to make more and more of our data assets available, at no charge for folks that were using them for strategic decisioning. We formed a rapid response team that was doing R&D work in kind of a quick, short capacity, bringing our three major data assets of consumer and claims and provider data together to help identify at-risk populations and ultimately some potential care capacity risk. I know we embarked on and participated in a MITRE initiative and worked really to share our continuity plans to make sure that we were having that dialogue with our clients and able to understand and support their emerging business needs, because as many of these speakers have said, they're shifting quite widely in a short window of time. We've definitely seen transitions of focus from one point in time to another shift very, very quickly throughout the course of the pandemic. In terms of your question on innovation, we've definitely seen more and more innovation, I think, across the board with our interactions with customers. As all the folks on the phone are aware, we've gone from a lot of face-to-face provider interactions with patients to more and more of this occurring in a remote capacity. So we started to see the adoption of not just telehealth, but knowledge-based authentication and device assessments to help make sure that it's the appropriate identity you're interacting with to keep high standards of cybersecurity. We've seen a lot of focus within the industry of folks pulling out and identifying not only new practitioners and testing locations, but emerging NPIs. We've had a lot of analysis from different clients that are looking at SDOH type attributes to identify not just the at-risk population, but potential ability to integrate those attributes kind of upfront to help steward conversation and proactively mitigate some of those risk factors that could come from social isolation, which I know we're all struggling with, but also economic instability and access to transportation to really keep continuity care and the overall wellness of their population. We've definitely also seen, and I'm kind of curious from the other panelists as we progress today, some of the things that you're doing for future planning. With all the delays in elective surgery, changes in volumes of procedures that historically would have been addressed but are going unaddressed, as folks are practicing social distancing, how you're preparing for kind of the swell that could occur as states reopen and identify really which practitioners ultimately will have a large backlog of patient needs, which typically would have gone unaddressed, but are now going to hit all at once. Anthony, I know I kind of talked about a lot, but do you have any questions for me, or?
Yeah, well, I think I want to let you ask that question that you wanted to ask your co-panelists. We're just going to go right to it because what a segue. So, do you want to, Mike? Do you want Rick to repeat the question, or did you get it?
I think I got it, and it's how are we going to, and I'll put in quotes, resurge, and how are we going to get back from where we've been when we closed 70% of our ambulatory clinics and we eliminated all, again, non-essential surgeries. And we're about into week 3 of that path. So I think I actually have some real life experience here in moving the health system forward in that resurgence manner. And we're doing it in a phased manner. And we're doing it in coordination, most importantly, with our state government as well as our city government to make sure we're staying within the confines of what's being recommended by them as well as the CDC. But as mentioned, we made significant cuts in services in order to prepare and then address any surge activity that's taken place. Our peak for inpatient COVID patients was about April 20th, April 21st, where we hit our peak. And subsequently since then, much like Laishy, we've seen some significant drop-offs, including today being about the lowest back to almost mid-March. So quite a drop-off and quite good work from a social distancing work amongst other activities here in the Philadelphia region. Each week, we tried to add 20 to 25% more volume associated with either our inpatient census to be non-COVID, as well as opening ambulatory clinics. And we have a staged approach as to what clinics would open over time. The goal is by June 15th, so it would be by next week, is to be back to 100%. So as indicated, we're in about the 3rd week of our resurgence. We're going to get close to 100%, I suspect. We're on a good track, but much like I think what others have found, not only on this panel, but across the country, patients are scared of coming back to a clinic, to a hospital. Their perception is that there's this wild virus that's not known that well, that's just floating around the airwaves and in the air conditioning unit, and that if they go down there, it's going to be really bad for them. They're going to come out worse than when they came in. And I think all of our emergency departments are seeing that impact also with significant drop-offs in emergency department volume. So phased approach, coordination over 4 to 5 weeks. And I think, eventually we'll all get back, but getting the confidence of patients is really important.
Very good. Before we go to you, Lacy, on that, I want to say hi to our friend Joel Venko, my good friend, who's joined us. So Joel, thanks for jumping in.
Hey, Anthony. Sorry I'm late, everybody. We had a moment of silence for 8 minutes and 46 seconds that was really focused on all the events that are going on today. With the protesting and the riots and all that's led up to these events these past several weeks. So I'm sorry I'm late, but I felt that was the right thing to do. Particularly for our organization who's looking to leadership to really understand what to do with a lot of these things, a lot of these issues that we're now having to grapple with in addition to COVID. So thank you, Anthony.
You got it, Joel, and I think we'll touch on that in a little bit, but do you want to just give a quick overview of your organization and your role?
Sure. Senior Vice President and Chief Information Officer for Baystate Health. Baystate Health is a health system in Western Massachusetts serving about 1.2 million patients. We have 2 ACOs, about 100 medical groups across the region, 5 hospitals and academic medical center. Also really a very new medical school, about 3 years in, We have 3 classes focused on population health and primary care. And we have a commercial health plan that we own, Health New England, which is about 250,000 members. So happy to be here with you, Anthony. And the rest.
Thanks, Joel. All right, Lacy, I think it's your turn to respond to Rick's question, which Mike addressed about opening up again, getting people back in, getting people comfortable to come back in.
Thank you. Yeah, again, I'm going to sound a bit like a broken record, but with our geographic dispersion, it's sort of each state and market is a little different in how they're coming back online, but some general themes that we're seeing, I think some have been quote unquote open and back to doing elective cases and so forth for well over a month now. Knock on wood, I almost hate to say it and not jinx it, but we're seeing volumes come back very strongly. In some of our markets, our ICUs are quite full, not with COVID patients, but with non-COVID patients because of that pent-up demand that Mike talked about. And I think, frankly, fear and deferral, ignoring or setting aside some symptoms that were maybe showing that there were some serious things that needed to be attended to. So as we anticipate possible resurgence of volume, we're really trying to make sure that we're keeping an eye on our ICUs because many of them are getting full. We're seeing really nice return in practice volumes. You know, what we haven't specifically talked about, and I'm sure that we all really stepped up, was the increase in virtual visits during the pandemic, which we would like to double down on and retain as much as possible. So the first number I'm going to quote is actually embarrassing. So before the pandemic, we did only 21 virtual visits across our entire 10 million organization in a day. Now, it wasn't because we don't have the technology. It was because of, I think, largely tradition and provider preference and frankly, reimbursement for those types of visits. In the height of the pandemic, we had 8,800 video visits in one day. So going from 21 to 8,800. Settling down now at about 6,600 visits on a typical day in our practices. That actually includes some volume for hospital outpatient therapies, speech therapy, OT, PT, where it makes sense to do it virtually. So we're trying to be mindful of maintaining social distancing and virtual visits where appropriate. Obviously, and other things, you know, we haven't yet developed that technology where they can be done virtually. So Anthony, I'll stop there. We are seeing volumes come back. We're seeing a lot of sick patients. Mike mentioned the impact in the EDs, and hopefully we'll be very adept at juggling the next wave and increase of COVID patients alongside non-COVID patients.
Rick, do you want to restate your question just for Joel?
Yeah, before we jump to Joel, though, Laishy, I did have another question that kind of came out of that. So we've definitely seen a large increase in telehealth services across the board. I'm just wondering, as you all have been going from kind of low volumes historically to now adoption of it across the board, are you seeing any specific specialties that are adopting more than others? And have you taken steps for additional identity assurance for the folks that are logging and using it? I'm asking because we've seen, you know, upticks in fraud in some ways, and knowledge-based authentication, device assessment, things like that are certainly active topics within the industry. I've seen some folks adopt that and some not. I'm just kind of curious from your organization's lens.
I'll be very
Joel, you want to? Oh, go ahead, Lacy. Go ahead, Lacy.
I'll be very transparent in my reply to your question, Rick. I would give us an A+ in agility and stepping up and providing a lot of different ways for providers to do virtual visits. We have a plethora of solutions depending on, we certainly have solutions integrated through my chart since we have Epic instances. In some cases, it was just very difficult for providers and patients to connect using that technology. So you name the virtual visit technology, we're probably using it. We got A+ on being agile and stepping up and being creative. I would give us a solid C on consistency, standardization, selecting best tool. That is now our focus, is sort of saying, hey, this is the new normal. We've got to refine what our approach is, standardize it, and make sure we're really using best practice. So to be honest, we're just starting to think about how to hardwire some of those things in, Rick.
Great answer.
Thank you, Laishy.
Joel, you want to touch on that at all? And Rick also asked about sort of opening up plan.
Yeah, so on the resurgence, or I'm sorry, the reopening, we are actually in phase 2 in Massachusetts. Elective surgeries aren't really coming until, you know, non-urgent elective surgeries aren't really going to be coming online until the end of the month, really. But we never really closed. So, you know, this reopening is really kind of, as I think Laishy had put it, is sort of at some level, a renewal of how we do business. And a rethinking of that process. And so we are also seeing a very strong, you know, return of patients, and actually it's both virtual and physical. We do see a lot of no-shows though. So we're seeing a lot of folks that are, you know, last minute sort of kind of reneging on their appointment and trying to reschedule for another point in time. So there is a safety issue. There is a patient perspective of, or perception of, you know, how do I know things are safe? And that is really where we're focusing our communication, our redesign, if you will. We're doing a lot of human-centered design work to try to figure out what the new process will be to sort of bring folks in. We call this project the Peri-Visit Project, which is everything around the visit. You know, what do we need to do to make folks aware of what their behaviors should be when they get to the campus? What things should they expect? And then how can we engage with them in the ways that that meet their needs? Some are coming off a bus, others are actually driving in a car and are able to park and connect with us and say, I'm ready for my appointment. And so there's a combination of process and technology that we're putting into place that is really no different from what you're seeing in your you know, your local you know, burger joint now, or you know, restaurant, where folks are actually really used to that process at some level. So we're trying to figure our way out, our way into really creating that capability. And so there's more to come on that. And some of those tools, by the way, are ones that we've developed in the past, and others, you know, we're actually looking to partner with third parties who are now in this game, right, of trying to help folks with intake and what we call peri-visit. On the telehealth side, I absolutely concur with Laishy. Absolutely the same. You know, we kind of went out there gangbusters. We went from literally, you know, very few televisits to basically thousands of them a day. And so at this point, we are trying to optimize and really centralize our focus on a particular technology, maybe two. We don't think that one is really sufficient for a number of the use cases. So we're trying to pare it down to 2 optimized ones right now. And then in terms of security, processes, all those things still in the works. So, you know, we went from flexibility and nimbleness to now optimization and really figuring out what our standard is. So.
All right, very good. Mike, let's start with you on this one. I had heard these statements in different events that I'd moderated and done, and I found them very interesting. Not a sense of excitement, but maybe a little bit of that. Sort of all the experience I'd attained over my years, you know, working up to the role and then being a CIO at different places. This is what it almost felt like. This is what it was for, you know. And I'm at the right place at the right time to handle it. Do those sentiments make sense to you?
So this is where I might be the naysayer on the panel and stir a little action, but no, this is not what I trained my whole life for.
Okay.
This, as I've shared many a times, I use the analogy of every week's a new chapter, and there's some good that's coming out of some of these chapters. The telehealth, I think, is one thing that will persist for periods of time. Remote workforce will persist for a period of time. Remote engagement and monitoring of patients, I think, will persist. And I think there's some good things, but no, this is not what I spent my whole career waiting for. But I do feel, probably in alignment with my panel friends here, is that we were prepared. We were prepared and be able to be nimble and agile because we've developed a really strong team. My team is somewhere around 1,000 individuals in corporate IS across the enterprise. And we have done a really good job of recruiting, retaining, and employing folks that are very experienced. So when it came time to change on a dime and be prepared for moving the workforce remotely and standing up telemedicine at the same time and that same weekend and that same week, standing up our command centers, which have been so valuable, we go through that. We were able to address all things. So I don't know how my panelists feel, but I would rather have focused on the things we were doing to improve research, accelerate research, improve patient care, and move the ball forward versus trying to react to a crisis that does have some silver linings. But I think we all would have been better off had the crisis not hit.
Well, I appreciate that honesty. It's not the response I expected, but it's very good. Rick, your thoughts on sort of this taking place at this point in your career and the position you were in?
Yeah, I'd say first, the statements that you brought up were exceptionally positive and not ones that I personally identified with right out of the gate. That said, I've been a remote worker with Lexis for about a decade. So from a personal position, I felt in a good spot in terms of my day-to-day, but also to help others who are making that transition home for the very first time. There's definitely an ongoing social isolation that is occurring and having a profound impact on mental health our day-to-day. So being an opportunity, creating opportunities for folks to engage with one another through social mediums like Zoom or Microsoft Teams, things like that. We've had a number of leaders that have kind of stepped up and are hosting 30-minute virtual coffee breaks, things like that, in order to help build a sense of community, keep us focused on the mission, and have a personal aspect to it. I'd say from kind of the way we're doing business, it has created an opportunity for us to support individuals within the industry in ways that traditionally we just haven't necessarily been able to do in such a large scale. The adoption of telehealth, as I mentioned, kind of has a natural extension to a lot of knowledge-based authentication, device assessment type technologies. We've seen risk populations being stratified, looking at claims. So we use our age and comorbidities data to help provide a lens into those populations that could be most drastically affected, in addition to our SDOH attributes that could prevent optimal health outcomes if they're not proactively reached out to and have mitigation plans in place. I would say from kind of a personal lens, the piece I miss the most is the collaborative discussions, hearing folks' pain points, best practices that occur in more conference settings. For me, I was all teed up to go to HIMSS this year, and that was wiped out pretty upfront by the pandemic, with it having been canceled just a few days before. I miss that ability to have my dialogue and interaction with other industry stakeholders more directly. Though those things, obviously, through forums like this, have started to emerge. There's definitely been a lull in time where we haven't had quite that opportunity. So I'd say it's provided some opportunity for us to bring assets together in ways we haven't. It's provided us as communities to kind of redefine our missions and visions and how we work together. And I think it's a good exercise for the long term for us to take away what worked and what didn't work, and work on our business continuity plans as a whole, understand what technologies are needed to support not only remote workers but remote patients, and making sure that they have access to the care. The telehealth piece, Laishy, is specifically impactful to me. I'm a new parent. So when my pediatrician finally was able to do telehealth services for my now 11-month-old, I was relieved, because every interaction was stressful up until that point in time. But I think it's going to have a big impact in terms of even how offices are structured. Ins and outs through the same doors aren't things that people are necessarily as comfortable with ongoing. So, hearing how those business continuity plans, hearing how that infrastructure will change, both from a physical and a technological, is an area that I'm seeing a lot of growth and discussion within the industry.
Joel, you had mentioned that you were a few minutes late today because of that moment of silence for what's going on in some areas in the country. You had this crisis you just went through with the COVID situation. Did you feel like you're at the right place in the right time to handle some of these things that are coming at you?
I was really excited about this question, because I think this is one of those moments where, us as INT professionals, as CIOs really can showcase, I think, what we've all been working towards over the last several years. You know, and first I'd like to say you're welcome to those folks that are leveraging the platforms that we are now even much more, you know, kind of indebted to and involved with. You know, it's a great time for us to talk about, you know, why we do things like the unsexy work in infrastructure, right? About 5 years ago, we sort of transitioned this notion of going and building another 10,000 square foot data center to a more software driven data center type of capability, you know, hyper-converged architecture. And folks were saying, well, you saved a lot of money, but why are you doing all this work? Why do we need to do this now? Folks were asking about, well, why do we need to go into virtual desktoping? We've got laptops and desktops. Why, Joel, do you want to do this? What's with this work on data? I don't understand data governance. Why do we need interoperability? Why does anyone need an analyst who's going to look at, you know, data standardization and normalization? Why do we need that stuff? That doesn't create a return for me. By the way, why do we need an innovation center? It doesn't make any sense because we were in the here and the now. We need to focus on the operations today. I don't want to look at, you know, 3 weeks from now, 3 months from now, 3 years from now. That doesn't make any sense. And so all of these things that I think all of us as IT professionals have been, you know, either talking about, preaching, discussing, envisioning, trying to convince our partners that this is the way for us to really prepare for. I mean, we didn't prepare for a pandemic. We were preparing for the future of healthcare, but the future came crashing like literally in a week. And, you know, somebody said, Joel, I know we have 300 people remotely working. Can you make it 5,000 tomorrow? And the answer was, you know, that check I asked you for a year and a half ago, 2 years ago? Well, why don't you write it now? And then we'll get there, you know, tomorrow. You know, one of the things that I do think that was really also beneficial was that we showed that even though we didn't, for example, fund all of the virtual desktops, you know, that we had requested a couple of years ago in its totality, we had learned lessons that enabled us to quickly ramp that up. So I think, you know, both Mike and Laishy and Rick, I'm sure they would agree that while things that we had said to our board or our president's cabinet, whatever you call your executive team, and you said, you know, we need to do X. Maybe you got some partial funding. Maybe you created, you know, a bootstrap way to actually still achieve some of it so you could learn from it. And that, by the way, is some of what these great CIOs do today is they figure out ways to still do the projects that they believe are right and that they believe will progress and transform healthcare. And for those that didn't do that, by the way, would have been said at that, you know, very moment, I'm sorry, it'll take us about 5 months to get virtual. It'll take us, you know, another 9 months to get any of those, you know, telehealth tools, or we can write a big check and we can bring a third party in and they can do all that work for us. And we're still going to be in line, by the way. So I think this is a moment that many CIOs, whether they believe they were preparing for it, were preparing for it because of the great work they were doing operationally, strategically, and the belief that you are part of the vision and really the strategic, you know, sort of the strategic platform of the health system, and not just the back office IT shop as it was in the past. So.
Very good. Lacy, anything you want to, wherever you want to jump on that, you know, as far as all the things you're dealing with as a leader right now?
So first of all, I would say yes and to every single reply. So I think we might have combined a little bit of, did you want it to happen with, were you prepared? So obviously none of us would have signed up for well over 100,000 folks in our country to die. And for what has been, I think, a disruptive event, which will forever change the way healthcare is provided, none of us would have scripted that and said, this is how it's going to happen, and push that profound change that we've all been planning for. To Joel's point, I often would wonder, when are we going to see some kind of tipping point with virtual care? And, you know, and then it happened overnight. So I am among those who would agree with your statement, Anthony. I would have hated to have missed it. And one of the things that I felt professionally and personally was most gratifying was if ever the rest of the C-suite did not appreciate how essential information and technology was to running our ministry, our organization, boy, it was crystal clear when we could spin up capacity for virtual visits and for like others have said, tenfold increase in virtual workers by 5,000 or 6,000 literally over a weekend. It was crystal clear then. So from that perspective, it was very fulfilling and rewarding to see the great work that our team has done validated.
And
Very good.
Anthony, can I make one quick comment?
Yeah.
And I know my colleagues also have innovation centers of different sorts. Just sort of as a kind of a public service announcement for folks who are thinking about innovation centers of their own, whatever that may look like. I'll tell you, the innovation center that we have really shone through during this pandemic because, you know, their focus has always been to look at the horizon for us while we focus on sort of the today and we have our heads down. You know, I call them our periscope of the horizon. They kind of look to see what's coming and they kind of inform us on what things that we might want to look at that would improve our operations, transform our health system. During the pandemic, what they became was still that horizon looking organization, but, you know, 5 days out, 10 days out. And they truly became that vehicle for our organization. And they actually spread, you know, their scope, not just to technology, but also to looking at partnering with, you know, local manufacturers for PPE, you know, production and gown production. And so, you know, for what it's worth, if you have a group that looks sort of towards the horizon, it will really help, not just, you know, in sort of whenever the new normal comes around, but whenever a pandemic like this or an epidemic like this occurs, you have these individuals who think differently, who think about the horizon. Those folks are super important in the planning and even the sort of the actions that you need to take today to get to that solution during a pandemic or any kind of crisis. So just a little thought for folks.
I appreciate that. I appreciate that. All right, we're going to throw out the audience poll question. It was just launched and our panelists can also answer. And this is anonymous, by the way, so don't worry about it coming back to haunt you. I was impressed by the quality of leadership I witnessed at my organization during the height of the COVID-19 crisis. So looking to see how people feel about the things that they witnessed. And I think this would be an interesting question. Tell a story about your conduct during the crisis that exemplifies your style of leadership. Rick, why don't we start with you?
Sure. So one of the things that I actually think has been most effective for our organization has been the over-communication instead of under-communication. As I think most of the panelists have mentioned, we've had to learn to be very agile and flexible in terms of what technologies we're kind of adopting and how folks are even working, given that they have, in many cases, families at home, a lack of childcare. They're trying to juggle their daily work lives as well as all of their personal lives simultaneously, day in and day out. So I know for myself that the overall embracing that's occurred among our leadership, not only in their compassion, but the fact that they want everyone to be in communication with one another, encourage those sidebar dialogues, encourage flexibility and understanding while folks are kind of in this remote capacity, and then also realignment to how each of the things we do in a day-to-day basis is helping to support our broader mission, which is entering the workflow, keeping our insights in the workflow, and helping build healthier communities. There's really been no better time to help showcase and provide assets in which we can really make a direct impact with that mission. So the leaders that I've seen that have been very successful during this pandemic and kind of anecdotal stories are those that are reaching out. They're going from conversations with a handful of senior leaders to sometimes hundreds of people within their organization as just typical check-ins. It's building relationships, it's reinforcing, how folks are interacting with one another, and ultimately, I think showing a certain level of trust that is really important among a population that is, in some ways scared. Not only, security of their position, security of the economy, security of their health, with all of the isolation that we're having on top of it, telehealth has been an interesting area because we've seen, we've been looking at referral patterns. We've seen massive increases in referral for behavioral health, mental health type referrals, where folks need some additional wellness or mindfulness and someone that they can balance and kind of speak their mind to. So the adoption of that and the opportunities that leaders are creating to, foster kind of not only that sense of community and reliance on one another, but opportunities for folks to receive those services has proven very valuable, I think, within our business at least. I'd be curious to hear from some of the other leaders on the call, if they have any specific stories themselves, or if there's general practices that would be valuable to other businesses as well that you found as successful for your organizations.
Mike, let's go to you next.
Thanks, Rick, and thanks, Anthony. I think the style that exemplifies our leadership is teamwork, and I mentioned that term earlier, but at the senior level, and I'm big into sports, and our leadership team is big into sports, we functioned as a well-oiled team, with our CEO being that quarterback, perhaps the CMO and CMIO representing the clinical community. And again, there was so much unknown back in the early March, April timeframe to represent and advocate for our employees as well as for our patients. And then many of us, whether it was finance, whether it was IS, whether it was HR, I sort of felt like we were the special teams players, where we're enablers of the vision, and we're enablers of the strategy, and asked, to help with supply chain issues. And I'm combining this answer a little bit with another prep question you had, which was, did you have an aha moment as you went through all this? And I thought, and I said, wow, I did. And what I couldn't believe was after our clinicians working 12, 14, whatever shifts, when they were done, they sort of couldn't go home because their family was concerned that they might bring the virus back with them, or they had a compromised spouse or child at home. And I was like, that's the craziest thing I've ever heard. And our response, much like others, was we went to hotels in the Philadelphia region and gained allocated space so that our clinicians could rest comfortably and keep their families safe. And so what does that have to do with IS? Well, they needed project managers to do that. And they needed someone to track who was going when, where. And that was us enabling what at the point was just an aha moment. So teamwork, everyone knowing their role and following the direction that was provided by the team, and most importantly, our CEO.
Very good. Next, we'll go to Laishy.
I'm going to answer more directly the you posed a story about conduct during the crisis that exemplifies my leadership style. So one thing I forgot to mention as I was talking about our ministry is we, at the start of the pandemic, we had been a merged organization for only 15 months. And so my style throughout the merger, which if you haven't been through one, you can probably imagine, highly political, highly charged. You got to be adept at crucial conversations, stakes are high. Folks end up without positions, or people you've worked with for a long time. So one of the big things in our organization that we were holding our breath on was, even though we've been very intentionally focused on building a high trust organization where we're going to hold together when this crisis hit, and we were fairly new at two merged cultures and so forth. So some of my leadership behaviors are I very intentionally build relationships, and I'm very transparent. And I think those two attributes served me well as a leader during this crisis. I had a good friend who would say, leadership is your ability to hide your panic from others. Never let them see you sweat. But this combination of vulnerability and transparency high trust of your team, but also exude, we got this, I'm confident, I know this team can do it. And I always did know the team could do it. And I'm blessed with a phenomenal team. So they really stepped up and did some remarkable things.
Yeah, Joel, I think Lacy's points are very interesting and well taken, right? I mean, to be a good leader takes these combination of things, and there's a lot of subtlety. So it's almost like you have to say to everyone, we got this, and then you turn around and to yourself, you go, I don't know how, but I'll figure it out, right? I mean, we don't have all the answers, but you can't express panic or confusion. You got to put on the brave face. So what are your thoughts about that, and in your style?
Yeah, no, that's absolutely right. I mean, I think you really, as a leader, have to show some level of calm within the storm. And you may not know all the answers, but I think, and I think Laishy and Mike had brought this up, you know, empowering and trusting your staff goes a long way because they'll follow you anywhere, particularly if you're transparent, you're vulnerable, and yet, you know, you provide them with some understanding that, you know, you're going to hold the ship, even if it strays slightly, you know, away from course. And I think that's what we saw. You know, I knew they didn't know what my roadmap was, and that they probably already knew that I didn't have, you know, a clear roadmap. This was not a downtime. This was not a go live. You know, this was a true epidemic of different sorts. And we were also lucky because we had a chance to connect with folks across the country. I did, you know, with my colleagues across the country, and I asked them, you know, like the folks in Seattle or in California, what are you guys up to? What have you seen? And I would report that back to my teams and say, this is what I'm hearing. This is what we're thinking about doing. But certainly communication, trust, empowerment, and then having some level of, you know, of a vision is always helpful as a leader, because that helps your team, you know, at least take on hope, but also feel like, you know, they have a leader who trusts them and you know, is flexible and understanding enough to move the ship forward. You know, I think one of the stories that I would bring up is, you know, I would hold town meetings or town halls, and we did it virtually, and you know, I would have all 700 employees come on board, or plus whatever other employees from even outside of my INT shop would come on, just to listen to see, you know, what other leaders were talking about or what I was talking about. And I can't tell you how many comments I got just simply from folks just saying, I'm so glad that you're talking to us. Thank you for the information, even though you don't know all the answers. And we appreciate you recognizing the work that we're doing. We had a weekly stand-up where I would, you know, my deputy would basically talk about all the great things that occurred during the course of the week. Because I know my colleagues online had probably posted, you know, 120%, you know, effort and work. Nobody was doing nothing. Everybody was doing something, and a lot more than something. And so that recognition also went a long way. So, you know, I know that I don't make stuff succeed on my own. That's not what leaders do. What leaders do is to help folks really succeed, you know, on their own and with their teams. And we just happen to be, you know, the recipients of that good news. So.
Very good. Excellent response. We're going to look at the audience poll now. I'm going to make all my panelists guess here at the results. So what percentage of people agree that they were witnessing impressive leadership at their organization? Rick, give me a number.
73%.
So Rick is at 73? All right, I like it. Mike?
94%.
94. Mike's an optimist. Mike thinks everyone's very happy out there. Joel?
They should be.
You know, Mike took my number, so I'm going to go 90. I'm going to go 93. I'm going to go 93, Mike.
93. So you're really you really boxed him out.
Hey, I watch Price is Right. I know how Price is Right works. You know. Yeah.
All right, Lacy, what do you got?
You know, I would guess right up with them on the high side. So high, low 90s.
Low 90s?
Mm-hmm.
All right, well, you got to give me a number, because we got Joel's at 93. There's not many low 90s left.
91.
91. All right. Well, the answer is, and let's share this, 87%. 87%. So,
I think
yes, Lacy's got it. Lacy's got it. You win, Lacy. You win the prize. All right. Listen, we only have like a minute or two left. So what I'm going to do is I'm going to give all our panelists an opportunity for a short parting thought. And what I'd like that parting thought to express would be advice, leadership advice, your best leadership nugget, piece of wisdom on how to be successful. Let's keep the target of these CIOs who maybe aren't very long in their career, fairly new CIOs, those aspiring to the position. What's your, based on what you've experienced since January, which is unbelievable, what the world has gone through since January, what's your best nugget of leadership wisdom that has sort of helped you be successful? Mike, let's start with you.
I would say real quickly that building strong relationships and over communicating have been the keys throughout this crisis and moving things forward. And those are just skills and qualities that will serve people well throughout their entire career. But building those strong relationships and communicating, and I think to Lacy's point and Joel's point, that building the trust with your team is ever more important.
Very good. Lacy?
You know, when Joel arrived, he was talking about where he had come from. And in my mind, that's a crisis equal to what COVID was and is. I'm very aware that there are a lot of people on my team who are hurting, and I've had conversations with them, and we're trying to create space on the team for voice. So my advice is lean in, even if you're not comfortable. So for COVID, definitely the role of a CIO was to lean in. You know, Mike talked about securing whole space, hotel space, I'm sorry. So don't just stay in your lane, lean in. And in the new crisis that we're experiencing of racial inequity and people who are hurting and people who don't know how to talk about it, again, I would say lean in and create space and be willing to be vulnerable with your team.
Very good, Joel.
Yeah, you know, I'm going to go back to, well, I agree with what Mike and Laishy said, of course. I'm going to go back to what I learned from my mom. And I think about this all the time. Actually, this is how I sort of score myself. And I got to say, I'm not near anywhere near an A on any of these areas, certainly. But, you know, she sort of talked about the 4 L's for me. And one was, you know, so it was always learn, always listen, lean in, as Laishy had mentioned, and then love. And so, you know, if you think about those 4 things, you know, that's what really makes, I think, the biggest, that sort of makes a difference for the L that we're all trying to aspire to, which is how do we become a leader? And I'd say that, especially today, the love part is something that we really need to focus on. And that has everything to do with understanding. It has everything to do with you know, empathizing and sympathizing. And we have to do a lot more of that. And I think we start with our teams. Our teams are absolutely the folks that we, without doubt, rely on and have to believe in and should believe in. And to be able to love them is I think, what's going to make them successful and the organization ultimately successful.
Very good. Rick, I'll give you the last word.
Sure. I'd say be flexible, adaptable, compassionate, and something I try and encourage with my own daughter, creative. I think creative solutions, the ability to be flexible and shift based on priorities, needs, just knowing that you don't ultimately know everything that's going to go tomorrow, and the best laid plans of mice and men, so to speak, you can only kind of roll with it to an extent. All preparedness has an opportunity to pivot and shift based on what your organization is specifically struggling with. But there's a wealth of creative solutions and technologies out there that can support anyone's business, so be open to them. You know, they talked about adopting a lot of different technologies for telehealth, and I think that was the right approach. You've got some folks that are going to be comfortable through different mediums, some practitioners that are going to adopt one over the other, and the ability to support all of those and then do a high level of you know, security and assurance behind it is important.
Very good. All right. That's about all we had time for today. Excellent conversation. Regarding CEUs, if you have any programs you're involved with, you can use the final slide in this deck. You'll get an email when the on-demand recording is ready. If you want to sponsor an event with us, you can reach out to Nancy Wilcox and you go to our website to register for our upcoming events. With that, I very much want to thank our excellent panel today, Lacy, Williams-Carlson, Mike Restuccia, Joel Venko, and Rick Grape, and I want to thank Lexisnexis Lexisnexis Risk Solutions for making this event possible, and thank our panelists for attending. Everybody, have a wonderful day. Thank you.
Thank you, Anthony.
Thank you.